Nephrotic versus nephritic syndromes. Probably one, if not the most important topic in renal pathology for board exams like Step 1. Before we jump into the individual diseases, we have to first understand what nephrotic and nephritic actually mean. So as you can see over here, I've drawn the glomerulus and I've labeled it. So here are the podocytes, here are the basement membranes, endothelial cells, red blood cells, and proteins. So let's say albumin. Now I've drawn two separate pictures over here, and I'm going to draw arrows for them, and they're each going to represent which syndrome they are. As you can see on the left side, we have more proteins than we have red blood cells. This is to signify nephrotic syndrome. And on the right side, we have way more red blood cells than proteins, and this is supposed to show nephritic. A quick way that I like to remember how to distinguish whether this is nephrotic has more protein or not is by taking the O in nephrotic and saying that this stands for a lot, like a lot of protein. All right, so there's that. Now we're going to compare them quickly. Nephrotic syndrome is defined by massive proteinuria, generally more than 3.5 grams per day. Because of all this protein loss, the urine becomes frothy or foamy. The main protein that's lost is albumin. So patients develop hypoalbuminemia, right? You lose albumin in the urine. Now, to compensate, the liver increases protein synthesis, but it also increases lipoprotein production, leading to what? Hypercholesterolemia. That's pretty cool, huh? You have kidney damage and then you have like a crap load of cholesterol in the blood. Like, what's going on? Now, patients also become hypercoagulable because they also lose another anticoagulant protein. Which one? Antithrombin 3. This is why patients have a hypercoagulable state. Now let's look at nephritic syndrome. You still lose protein, but not nearly as much, typically less than 3.5 grams per day. Instead, the hallmark finding is hematuria with red blood cell casts, which occurs because inflammation damages the glomerular filtration barrier and allows red blood cells to pass through. So before we move on to the different diseases, remember this key idea. Nephrotic, the O is for a lot, more than 3.5 grams per day. And nephritic is less. If you remember that nephrotic is the protein problem and nephritic is the blood and inflammation problem, the rest of renal pathology, especially when it comes to identifying, becomes really easy.